Hello, this is Dr. Philip Mease, Director of Rheumatology Research at Swedish Medical Center and Clinical Professor at the University of Washington School of Medicine in Seattle, Washington. I will be discussing the abstract Secukinumab Achievement of Psoriatic Arthritis Disease Activity Score, or PASDAS, related remission, 2-year results from a phase 3 study by Laura Coates and colleagues. This abstract was presented at the American College of Rheumatology meeting in November 2017 and subsequently published in Annals of the Rheumatic Diseases in 2017. I selected this abstract because it emphasizes Psoriatic Arthritis Disease Activity Score, or PASDAS, as a continuous measure of disease activity. Thresholds of remission or low disease activity in this composite measure, which holistically assesses the multiple clinical domains of PSA, may be a target of therapy in patients with PSA. This post hoc analysis of the Future 2 study assessed the ability of the IL-17 antagonist Secukinumab to achieve low disease activity or remission using PASDAS through 104 weeks. Previously published, the Future 2 study showed Secukinumab significantly improved the signs and symptoms of PSA over 104 weeks. This post hoc analysis of the Future 2 study used the PASDAS as a measurement to distinguish treatment effect, noting that performance is better in statistical terms than traditional joint-only in indices, such as the ACR score or DAS scoring systems. The PASDAS index is derived from Physicians Global Visual Analog Scale, Patients Global VAS, taking in both arthritis and skin disease impact, SF36 physical component score, tender and swollen joint counts, leads enthesitis count, so taking into account enthesitis as well, dactylitis count, and CRP level with validated cut points for high disease activity greater than or equal to 5.4, moderate disease activity 3.2 to less than 5.4, and low disease activity 1.9 to less than or equal to 3.2, and remission less than 1.9. PASDAS was assessed in the overall population and in patients stratified by prior anti-TNF use and disease duration, less than or equal to 2 years versus greater than 2 years since first PSA diagnosis, and reported using mutually exclusive categories at group level and as observed analysis. In the Future 2 study, 397 patients with active PSA were randomized to subcutaneous Secukinumab at 300 milligrams, 150 milligrams, or 75 milligrams, or placebo at baseline, weeks 1, 2, and 3, and every 4 weeks from week 4. Placebo non-responder and responder patients were randomized to Secukinumab at 300 milligrams or 150 milligrams subcutaneously every 4 weeks from week 16 if they were non-responders and week 24 respectively. What were the key findings? PASDAS remission and low disease activity were achieved in 38.5 and 34.4% of patients treated with Secukinumab 300 milligrams and 150 milligrams respectively, versus 16.1% in the placebo group at week 16. Approximately 50% of patients achieved PASDAS remission and low disease activity in both Secukinumab groups at week 104. A higher proportion of anti-TNF naive patients treated with Secukinumab achieved PASDAS remission or low disease activity than anti-TNF inadequate response patients through week 104. Secukinumab treated patients achieving PASDAS remission had significantly greater improvements in function, quality of life, and fatigue. This study shows that the holistic, meaning measuring all clinical domains in PSA, including, for example, enthesitis, dactylitis, and skin disease, as a continuous measure that's specific for PSA, is being used increasingly in trials and shows good utility. Before beginning my analysis, let's hear about some of the study's highlights from the lead authors, that's Laura Coates' perspective. This is her commentary. I think the abstract highlighted the importance of achieving remission for maximizing patient benefit in terms of work disability, function, and quality of life. It gave further support to the use of PASDAS as a measure of disease activity, and specifically as a definition of remission or low disease activity from the patient's perspective. I'm not sure that this will have a direct impact on care that much now, although it does highlight the potential benefits, alongside other data, of achieving a target to improve outcomes and support the use of treat-to-target approach. The other benefit it has is to allow us to translate research findings into what they mean for patients. Here are my own thoughts and analysis of the study. This study, the index portion, focuses on the measurement and how it focuses on the quantitation of disease activity. The Psoriatic Arthritis Disease Activity Score, or PASDAS, worked very well as a composite index to measure disease activity. As such, PASDAS is a worthy and reliable holistic measure for use in clinical trials to measure PSA. The threshold of remission and low disease rate were met by approximately 1/3 of the patients in treatment groups as early as week 16. The long-term observation was also positive. By week 104, 50% were in PASDAS state of low disease activity. For rheumatoid arthritis, increasingly, rheumatologists are using a treat-to-target strategy, using quantitative measures of disease activity to maximize achieving low disease activity or remission. We are also finding this methodology to be so in the management of PSA. We are introducing holistic quantitative measures that point the way to a treat-to-target strategy for patient care. Some may argue PASDAS is a complex instrument. However, it is quite easy to plug in the numbers to do the measurements. There remains the question of how readily a treat-to-target strategy, including assessment of skin disease, will be taken up by rheumatologists in practice. But I would hope that increasingly in the future, this will be the case.